Many Singaporeans are worried about falling ill and not being able to afford their medical expenses. A survey conducted last year by Mindshare, a global media and marketing services firm, found that 72% of Singaporeans felt they cannot afford to get sick due to high medical costs. This echoes the sentiments of many Singaporeans I've spoken to, many of whom are elderly or have sick family members to care for. In particular, the high out-of-pocket payments at the point of treatment are a great source of worry for many. It is not uncommon to hear accounts of older folks ignoring health problems and delaying visits to the doctor because they fear that medical expenses will be a financial burden to themselves and their families. Medical inflation in Singapore was almost 9% in 2011, much higher than general inflation. Our people should not have to face these increasing medical costs alone. The structure of our healthcare financing system is a critical factor in determining whether healthcare is truly affordable for all Singaporeans. In Singapore, less than one-third of all healthcare costs are paid by the government. More than 60% of the costs are paid by patients out of pocket, which includes cash and Medisave. This is much higher than the average of 14% in high-income countries, according to data from the World Health Organization. Is it any wonder, then, that Singaporeans are feeling the strain of healthcare costs? High out-of-pocket spending can create barriers to healthcare access and use because people who have difficulties paying medical bills may delay or forego treatment even though they need it. It is a fundamental responsibility of the government to ensure that all our citizens have access to high-quality healthcare based on their medical needs and regardless of their income. The healthcare burden cannot continue to be borne so heavily by individuals and their families. Singapore's population is aging, and healthcare costs are expected to continue rising. The government must be prepared to shoulder a much larger proportion of healthcare costs than it currently does. We need to shift away from seeing healthcare as primarily an individual responsibility and emphasize more government intervention, risk sharing, and fairness in financing. We need to change the way healthcare is financed so that Singaporeans who fall ill can focus on seeking the most appropriate medical treatment without worrying about whether they are able to afford it. I would like to make a few proposals on healthcare financing to reduce the financial burden on Singaporeans when they fall ill, to improve the efficiency of the healthcare system, and contain medical inflation. First, on MediShield. MediShield is an insurance scheme intended to cover large hospital bills. However, it does not provide full coverage. Patients need to make hefty co-payments, in addition to other claim limits like caps on hospital ward charges and annual and lifetime claim limits. As a result, MediShield claims covered only 2.1% of total healthcare expenditure in 2011. In August this year, the government announced plans to provide expanded insurance coverage under a new MediShield Life scheme. These changes to cover all Singapore residents without exclusions for old age or pre-existing conditions are certainly welcome. They are consistent with what many Singaporeans and the Workers' Party have been calling for. However, I remain concerned about the rising premiums. The government has already warned that premiums will go up. While I accept that increased coverage will come at a cost, there are two questions we must consider. Should all of these cost increases be borne by policyholders? And will some groups of Singaporeans find the premiums unaffordable? MediShield premiums currently rise with age. An 86-year-old pays a premium rate that is more than 23 times that of a 20-year-old. The elderly shoulder a disproportionate premium burden. Policyholders over age 60 contribute about 36% of total premiums, even though they make up just over 12% of policyholders. Most of the elderly are retired with little or no income. It is unfortunate that many of those who are least able to afford the premiums are in fact paying the most. Many of our senior citizens have exhausted their Medisave accounts and have difficulty coming up with the money to pay their premiums. Every year, an average of 650 elderly policyholders opt out of MediShield coverage completely. This leaves them vulnerable and without insurance protection, putting them at risk of financial catastrophe if they fall ill. The government does not directly subsidize MediShield premiums, although it does give ad hoc MediSave top-ups to the elderly and a MediSave grant to newborns. I would like to propose that the government introduce a MediShield premium subsidy program for all vulnerable groups of Singaporeans. These would include elderly persons with no income and limited savings, people with disabilities, patients who have exhausted their MediSave, low-income families, and those who already qualify for MediFund, Public Assistance, ComCare, and the Community Health Assist Scheme, or CHAS. The appropriate level of premium subsidies should be automatically extended to them without a need for them to apply separately. This could help many more Singaporeans to cope with the rising premiums while ensuring that the MediShield fund remains solvent. While MediShield is intended to help cover the cost of large medical bills, policyholders will still have to make co-payments in the form of deductibles and up to 20% in co-insurance. Last year, over 2,400 MediShield policyholders made co-payments of over $10,000 each. These co-payments can be financially crippling on their own. Would MOH explore the introduction of an annual cap on out-of-pocket co-payments made by each patient? Any medical bills above the cap would be borne by the government. Such schemes are a feature in most developed countries, including Japan, South Korea, and New Zealand. It is one of the key consumer protections in the Affordable Care Act in the US. An annual cap on out-of-pocket payments will limit the financial risk that individual patients are exposed to and help allay the anxiety of many Singaporeans about uncertain medical expenses. From the government's perspective, co-payments are necessary to discourage overconsumption. The government's fear is that free healthcare will escalate costs and become fiscally unsustainable. However, people do not consume healthcare like they do other goods and services. Most people visit doctors rather grudgingly, usually when they fall sick or have obvious symptoms. Demand for healthcare is therefore not unlimited. A health insurance experiment conducted by the RAND Corporation, involving over 7,000 patients in the US, found that indeed, higher co-payments reduce the consumption of healthcare. However, the experiment also found that co-payments cause patients, especially the poor ones, to reduce the use of medically necessary care. The experiment found that poor patients with hypertension tended to avoid treatment, leading to significantly higher mortality rates. High co-payments have also been shown to have an effect on patients adhering to their prescriptions. In another experiment by researchers from Harvard Medical School, nearly 6,000 patients who had just suffered a heart attack were prescribed drugs that reduced the chance of another attack. Half of them had their co-payments for these drugs waived, while the other half paid the usual fee. The results showed that more patients in the zero co-pay group took their medication regularly. They saw their health improve, with lower incidences of stroke and repeat heart attacks than the patients who had to co-pay. Interestingly, the elimination of co-payments did not increase total spending by patients and insurers, and even reduce spending in some areas. The lesson from these two experiments is that if co-payments are too high, poorer patients may be deterred from seeking medically necessary treatment. Similarly, it is difficult enough to get patients to adhere to their prescriptions, and high co-payments could make it even harder. This could have knock-on effects like higher rates of hospital readmissions, which will cost both the patient and the system more in the long run. The government's claim that no one will be denied healthcare because of inability to pay is cold comfort for some Singaporeans who regularly forego medical appointments or cut back on prescribed medication because of high costs and the difficulty in obtaining financial assistance. A few weeks ago, I met an elderly resident at his home in Bedok who suffers from COPD, a chronic lung disease. He is unable to work and has no children to support him. When I asked him how he was coping with his medical expenses, he told me that he was using his MediSave but had almost exhausted it. I was disturbed to learn that he often skipped medical appointments and cut back on his medication just to save money. I told him that there was financial assistance available and that he should not compromise on his health. But he told me that he had given up applying for assistance because of all the documents he had to submit and the interviews he had to attend for the purpose of means testing. Recently, a colleague sent me a photo of a large banner at the counter of a pharmacy at a government restructured hospital that read, "Please inform our staff if you do not want to take the full supply and/or you need to know the total cost of your medication." These two situations illustrate how many Singaporeans find themselves making hard choices between getting the necessary treatment and saving money, and how the onerous process of means testing may be deterring some needy patients from obtaining financial assistance and therefore treatment. I've spoken in this house before about how all means testing should be done without the need for patients to physically submit income documents. The patients and their families should only need to give their consent for the provider to access their income records with the relevant government agencies like CPF Board and IRAS. This facility should be made available at all institutions, whether private or public. The providers of all assistance schemes, including Medifund, hospital endowment funds, and other charity schemes, should be able to access these records. This will better ensure that patients receive all the financial assistance that they qualify for. Better still, can vulnerable groups of patients be pre-qualified so they don't even have to submit any applications before receiving financial assistance? Currently, this is already being done for the CHAS card holders receiving outpatient treatment. MOH should consider extending the same for inpatient financial assistance schemes. As I call for the expansion of the role of the government in easing the healthcare burden on Singaporeans, I am also aware of the many challenges that our healthcare system faces in containing ever-increasing costs. We need to look into ways to contain healthcare costs while still improving patient outcomes. Many of the current measures to contain healthcare costs focus on curbing consumption by patients. However, most patients do not have sufficient knowledge to decide on the type of treatment they need. These decisions are usually entrusted to healthcare providers, which include doctors and hospitals. Therefore, providers drive the bulk of healthcare spending through their decisions to admit patients to hospital, order medical tests, prescribe drugs, and charge fees. Therefore, if we control costs, we need to actively engage providers. To achieve this, all providers, including GPs, hospital and preventive care providers, must be made collectively responsible for providing a full spectrum of care for patients. These providers should cooperate and share patient information with each other in order to make more accurate diagnoses and coordinate patient care. They should focus on keeping patients healthy and ensure that they take their medication regularly. These will minimize hospital readmissions, investigations, and treatment, all of which are more expensive. Providers should be paid based on the achievements of measured quality improvements, not simply the volume of patients they see or the level of fees their patients pay. All this could lead to healthier patients and lower costs for both patients and the system. Technology should be used as a force multiplier in the face of limited manpower in our healthcare system. While Singapore is no laggard in healthcare technology, its potential is not being fully realized. Often, the problem lies not with a lack of technical expertise, but with a lack of adoption. One example of this is the National Electronic Health Record System, or NEHR. The NEHR enables patient health records to be shared across the healthcare system. It can reduce medical errors and improve productivity and coordination between providers. This will lead to better diagnoses and treatment and reduce medical costs. The NEHR has been rolled out to all public hospitals, polyclinics, and long-term care providers. However, while over 5,000 clinical users have access to the system, what percentage of these users are fully utilizing the functionality of the system? Is usage lower than it should be due to usability issues, or some providers still preferring to use handwritten clinical notes? How is MOH ironing out these issues to increase usage of the system? The usage of the NEHR in the primary care sector is lagging even further behind. As at March this year, it had been rolled out to only about 50 out of the 2,000 private GP and dental clinics. The government has already invested $172 million to develop phase 1 of the NEHR and is paying about $20 million each year in maintenance costs. The subsequent phases are expected to cost more. While the government deems it important to recover the cost of developing and maintaining the NEHR, the goal of cost recovery must not impose a roadblock to the full adoption of the system by all healthcare providers in Singapore. It is important to ensure that all providers, including GPs and specialist outpatient clinics, enter the necessary clinical data into the system so that the full benefits of having electronic health records can be realized. Madam, healthcare is an issue that is close to the heart of every Singaporean. While we are all at risk of falling ill, unaffordable medical costs are not inevitable. The government must reform the way that healthcare is financed in Singapore so as to ease the healthcare burden on all Singaporeans. This will give our people peace of mind knowing that they will be able to afford all necessary treatment if they fall ill. Thank you.
Minister Gan.
Madam Speaker, thank you for allowing me to speak on this motion. Madam, healthcare cost is indeed a key focus in our Healthcare 2020 announced in 2012. It was also a key theme in this year's National Day rally. The Ministry of Health takes a multi-pronged approach to help Singaporeans with their healthcare costs. First, at the national level, we spend 4% of our GDP on national health expenditure. This is less than many other countries, but with good outcomes. Life expectancy rose from 78 years in 2001 to about 82 years in 2010. We have also seen steady improvement in other indicators, for example, lower premature mortality. Death rate for heart disease aged 35 to 64 fell from 76.2% per 100,000 in 2001 to about 50 in 2010. This is comparable to the top 25% of OECD countries, roughly on par with the UK and Sweden. We should bear in mind that we are still a young nation in terms of our population compared to many of the developed countries, although aging is picking up pace. And expenditure will indeed increase with aging population. Therefore, it is important for us to manage overall healthcare costs, and we do this through three key thrusts. Firstly, even as we expand capacity to meet the demand, we must also work on right-siting the patients to avoid overconsumption, which will drive up costs. Secondly, we must continue to improve productivity and encourage innovation in healthcare delivery. We must continue to seek new models of care that are more cost-effective. We must also, thirdly, preserve the focus on personal responsibility and step up our efforts on healthy lifestyle and strengthen our support for preventive healthcare. The key strategy of this is outlined in our Healthy Lifestyle Master Plan, which we announced earlier this year. And Mr. Giam also talked about co-payment. The co-payment is a very important component of our strategy to maintain and moderate costs. Co-payment, in fact, plays a very important role in our healthcare financing framework in preventing overconsumption, as Mr. Giam pointed out. Co-payment encourages our healthcare providers to focus on the more cost-effective options of treatment and not just the patients. So decisions are also made by service providers as well. As Mr. Giam has pointed out earlier on, the providers also need to be guided. They also need to be incentivized to provide the right appropriate treatment for the patients so that they are more cost-effective. And therefore, we need to be very mindful in managing both the patients as well as the providers. And we have indeed calibrated the amount of co-payment very carefully to ensure that they will remain affordable. But there is room for us to provide more help. We have announced earlier that we do intend to see how we can reduce the patient's share of healthcare costs, including co-payment through government subsidies, as well as risk pooling through MediShield Life as well. And we are also looking at injecting more flexibility in the use of MediSave. And this includes review of MediShield co-payment for the very large bills, which Mr. Giam talked about, as well as looking into the subsidy structure at our specialist outpatient clinics. These reviews are currently underway. For the lower income, we will also provide workfare to help them with healthcare costs. The workfare will contribute into their CPF MediSave account. I think co-payment will continue to be an important part of our financial framework to moderate the cost of healthcare. But we will need to calibrate, and we will continue to review to ensure that co-payment will remain affordable. We must recognize that an aging population and the changes in the family structure is taking place, and we will need to shift more towards collective responsibility and risk pooling. In addition, as we have announced earlier this year, government will take on a greater share of the healthcare costs. Over the last 5 years, government spending on healthcare increased at 15% per annum. This is much faster than inflation, GDP growth, and in fact, much faster than the growth in national healthcare expenditure. In recent years, we have increased subsidies significantly through CHAS, increased subsidy for the intermediate and long-term care sector, as well as we have announced earlier, we are also looking into enhancing the subsidies for the SOCs, and we will share more details on this in time to come. We will continue to do more to increase government share from current 1/3 to 40% or more, but we will need to be very careful and to be more targeted to help the low income as well as the elderly. Beyond subsidies, we will help Singaporeans with their share of healthcare costs through greater risk pooling, MediShield Life in particular, so that Singaporeans need not face the uncertainties in their health alone. And I'm glad that Mr. Giam supports MediShield Life. To enhance risk pooling, we plan to introduce MediShield Life for better coverage for the larger hospitalization bills, extend coverage to all Singaporeans, and for life. We have appointed a review committee to look into this in detail, and this is a major step we are undertaking from which there will be no turning back. This is why we have to consider this step very carefully. Insurance payout will be funded by premiums paid into the insurance fund. If coverage improves, payouts will go up and premiums will need to rise. And I'm happy to note that Mr. Giam recognizes this too. But we understand that there are concerns about the affordability of premiums, as Dr. In Tan and Mr. Giam both pointed out, and therefore the government will provide more targeted help for MediShield premiums. First, for our seniors, they have worked very hard to build Singapore's what it is today, but they earn less and have fewer safety nets when they are younger, when they were working. They will need more help, and therefore the government is working on a special Pioneer Generation package to help them pay for MediShield Life premiums, so that they need not worry about healthcare in their old age. This will also relieve the burden on their children as well, who may be supporting the elderly parents. Similarly, as Dr. In Tan and Mr. Giam has suggested, the government will also help the lower income to pay for the MediShield premiums. For younger Singaporeans, we are also studying how to help them pay for part of their old age premiums earlier, so that they do not have to pay so much premium when they are old. This is what we call pre-funding, as Dr. In Tan suggested yesterday, and Mr. Giam also touched on today. There's already a small component of pre-funding in today's MediShield, but we are studying if we can do more and to what extent we can enhance it. So through MediShield Life, the government will pay even more for healthcare for the vulnerable, but in a more targeted way. Government also provides annual MediSave top-ups to the elderly through our GST voucher, through workfare for the low income. From August 2013, the government will also be contributing $3,000 into every newborn Singaporeans into their MediSave to help them with a healthy start in life. We are making MediSave use more flexible so that Singaporeans can tap on more of their savings while preserving adequate balance for premiums and co-payments in old age. Further help from Medifund is also available for those who still face difficulties despite insurance and subsidies. But Medifund is a very targeted support, and it covers up to the full bill of healthcare bills that patients may incur. So we have to assess each case very carefully to ensure that help really goes to those who indeed need such help. And the criteria is quite different from the financial assistance through CHARS, and therefore CHARS may not be able to be used for assessment for Medifund. Healthcare financing system in Singapore is fundamentally sound, but we need to future-proof it so that it remains effective and relevant for many more years to come. This is our unique approach of subsidies and 3Ms, and it will remain a core to our financial framework. But we will continue to look at how we can strengthen this subsidy plus 3M to give Singaporeans greater peace of mind. Through collective responsibility, through government subsidies, through risk pooling from insurance and family support, we can help to manage and share the burden. But we must also keep an eye on overall costs, which will have to be borne by future generations if we are not careful. And in fact, if we do not carefully manage healthcare costs, tax burden on the population will increase significantly as we will have more and more elderly, and our children's generation will be paying for our healthcare costs when we ourselves grow old. We see this happening around the world, and this is why healthcare is a major preoccupation of many governments as they struggle to manage overall spending to keep healthcare costs affordable. And this is why we help Singaporeans put aside savings in MediSave, and we try to pre-fund as much as we can among ourselves in our MediShield, so this will help us avoid overly taxing the next generation. If we allow MediSave to be used freely and spread over the next few years, all these savings that we have taken so many years to accumulate could dissipate quite quickly. And what will we have left over the next, when we ourselves grow old? This may impose an undue burden on our next generation. And will this system be sustainable? Will we have greater peace of mind as a result of that? So we will continue to see how we can help Singaporeans share the burden of the healthcare cost. But at the same time, it is also very important for us to keep our economy healthy and growing so that we can provide good opportunity, employment, as well as rising income, so that Singaporeans can better afford healthcare costs and that we can have more resources as a government to help those who may need extra helping hand. Finally, as a health minister, I must say this: it is still most crucial for us to help to keep Singaporeans healthy so that we can reduce the burden of healthcare costs, not only on individuals, but also on the society as a whole. So I hope that we can work together to add life to years and not just years to life.